importantly, the subtle changes that have occurred, as the governor said, are talking about expanded confirmed case definitions. So in the past, a confirmed case was from a test. That test being a special kind of test called a PCR test. That's the test that we've been talking about for the most part all along. Now there are some new testing technologies available. We still don't have them in any significant amount in Ohio. One is a rapid genetic test called the ID Now. That's an Abbott test or a few other brands. Those can do a rapid 2-hour, but it's still more like those PCR tests. Pretty soon, as the governor said, the test I'm waiting for are the antibody and antigen tests that are prick of the finger versus anyone who's had this test knows what I'm talking about, or a flu test, the swab that you actually have go down your nose. And it's people who've had it know that that is not fun. Having a quick test that you can do blood on will help us rapidly diagnose people both with the disease and an antigen, and also people who have recovered from the disease. All of that data is so essential for us figuring out who now is no longer susceptible but has actually recovered. And as we know, we are all susceptible because this is a novel virus. So that new definition will be including the new types of testing that are now available, though I can tell you that is not really widely available in Ohio yet. What that did for us is change our case definition yesterday by about 17 cases. So it's still not a lot of numbers, but we want to be really clear with folks where we're getting our numbers as we move forward. And it also allows the diagnosis of cases in epidemiologic and clinical conditions. What that means is, for instance, in a nursing home, where we have very few tests available, once you've tested a couple of the nursing home residents, and they clearly, in the old PCR test, have COVID-19, we can pretty much guarantee that every other case, if they're flu negative and no other respiratory disease, are basically a spread of that disease. So those very detailed clinical cases that have a tie to a very clear person who tested positive as their exposure is also counted. So we see the tip of the iceberg right now. We have to be very clear and transparent with you. All of these numbers are a gross underestimation of the amount of disease out there. Again, most people are mildly symptomatic. 25%, up to 25% may be asymptomatic or carrying it, and we have no way of knowing that they're doing that, and we're not really testing those folks.